So the next TRM product I want to chat about is called GNF or Gut Nutrition Formula by TRM. And before we actually talk about how the product works, I just quickly wanted to go through the horse's stomach. As I have mentioned in previous videos, a horse's stomach produces acid 24 hours a day, 7 days a week. So the stomach comprises of two parts. The first part is the top part of the stomach. It is a non-glandular section that has no acid here, and it's very sensitive, and there's no cells there for protection. And then the second part of the stomach down the bottom is where the acid is produced, and it lies at the bottom of the stomach there. So this part is glandular, and it's got lots of cells to protect it from the acid that is produced and stays in this part of the stomach. So if you look at this side here, this beautiful white section is the non-glandular part, really sensitive, and then that bottom red part is where it's full of cells to protect against acid, and that's where it's produced and lies in the stomach. You can actually see the acid there. Horses, before they came domesticated, obviously they are grazing animals, and they graze all the time. They even wake from sleep sometimes to graze, and as a result the stomach produces acids all the time, so that it always has that there to help with digestion when there's roughage in the stomach. So again, the non-glandular part at the top and the acid that's produced at the bottom, when there's constant roughage there, that acid is there to help digest that, and then it pushes on through into the small intestine. So just for a little experiment that I'm doing, I just want to show you exactly what it looks like. So I have this little carton here, and down the bottom is the acid in the stomach, in the glandular part. This is the non-glandular part, and this is actually roughage. So you see, if I move, like even in a trot or a cantering motion, that roughage prevents any acid splash up to the top of the stomach. But unfortunately, due to our confinement of horses and not having them naturally graze all the time, due to confinement in stables for training and things like that, sometimes the stomach is left empty, depending how long or how many hours they're left in a stable without feed, which potentially happens. So where the acid keeps building up, there's no roughage there for the acid to digest, so it keeps building up, and when horses move or potentially exercise on an empty stomach, this allows the acid to splash up to that non-glandular part, and unfortunately cause lesions or ulceration. And this is what equine gastric ulcer syndrome is. You can see under endoscopic examination, this is quite a bad case of ulceration or lesions formed by the acid splash in the stomach, and it's horrifically painful. It really causes a massive change in your horse, because they're in pain. And again, just to continue the little experiment I have, in this bottle here, this would be the gastric acid in the stomach, in the glandular part. Top is the non-glandular part, and you see with bare movement we're getting a splash up onto that glandular part, which causes these ulcers. So it's a kind of just a good way for you to see how it actually happens. So what are the signs of equine gastric syndrome, ulcer syndrome? So obviously you've got mild colic signs are the main ones, where you potentially have rolling, kicking at their stomach, looking at their stomach, pawing, crib biting is another one, and of course you start to get a dull coat, weight loss, loss in appetite, a change in demeanour or attitude in your horse's personality, and sometimes intermittent diarrhea as well. So that's where GNF comes in, or Gut Nutrition Formula. So it really is a unique supplement that is used for daily feeding in horses who are prone to ulcers, gastric disturbances, and of course if they've got confinement for training, or they have a stressful induced exercise where they potentially don't have feed in their stomachs, and sometimes also they can get EGOS from non-steroidal anti-inflammatories, which are a lot of the time prescribed by vets, and this can cause ulcers if not protected. So the ingredients in GNF, how does it work? So we do have calcium carbonate and magnesium hydroxide. These are both act like antacids or pH balancers in the stomach, so it's really similar to us like taking Gaviscon for our heartburn, and it does combat the excess production of acid in the stomach, which is the main cause of lesion formation. Now what's awesome is a product, it's a seaweed product that is in GNF, and it's called Laminera Hyboria, and when this seaweed interacts with the calcium carbonate, it forms a gel, so it protects that sensitive non-glandular part of the stomach, but it also builds a raft over the acid in the stomach as well, so it prevents acid splash and protects the non-glandular lining. To help with that, we also have glutamine and threonine, and these are both amino acids, but they help in the production of mucin synthesis, which is pretty much putting an extra cell layer on that non-glandular part of the stomach, which also helps to protect it and gives it a protective barrier along with that gel from the seaweed and calcium carbonate. Another product that is in GNF, ingredient that's in GNF is fructosaccharides. This pretty much is a carbohydrate, and it cannot be absorbed by the stomach or the small intestine, so it passes on into the cecum and into the large intestine. From here, it actually feeds beneficial bacteria like lactobacillus, and as a result, it actually then they grow at expense to the unbeneficial bacteria, and hence acts as prebiotics in the hind gut. Also helps with pH acidosis, that it can be gotten from high grain feeds. Kaolin is another ingredient that's added to GNF, and this is great because it acts as a toxin binder in the intestines, and it also can actually soak up excess water, so it will help if the horse has mild diarrhea or paddy stools. So that's a great product, and it's pretty much how GNF works. Other than that, we did have a clinical trial, independent scientific clinical trial, which we do have a white paper on, and it's amazing because it did show all the horses in the trial had been scoped and given a grade from grade 0 to grade 5. So those horses that were treated with GNF, they were given 50 grams twice daily, and it showed that it actually more than halved the amount of ulcers up to a grade 2. So I think there was horses up to a grade 2 that had went less than 1 within 6 weeks on GNF. So it actually proved that it, number 1, helps to prevent ulcers by protecting the stomach, and number 2, it actually treats ulcers up to a grade 2. So unfortunately in the trial, it is a natural product, so in the trial anything that had a grade 3 or higher, it didn't really help with the ulcers, unfortunately. So we do obviously recommend that a veterinary practice prescribes omeprazole, which is normally a 4 to 6 week treatment, proton pump inhibitor, but you can also use the GNF with that to keep protecting the stomach, and also to use afterwards to help prevent ulcers and to treat any small ones that are potentially still there. So it is a great product for that reason. So dosage, as I was saying, it is for an adult horse, it is 50 grams twice a day. For ponies, weanlings, yearlings, it's half of that, so 25 grams twice a day. And if a 10 kilo tub would last one adult horse on 50 grams twice a day for over 3 months. So it's a really good cost comparative product, costs about $1.75 a dose. So recommended retail price for GNF for the 3 kilo, it's $135, and then for the 10 kilo it's $339. So that's our GNF.